Hello, everyone, and welcome to tonight's Real Talk About COVID Vaccines conversation sponsored by the School of Education and Human Development, Africana Studies, and the Woodson Williams Marshall Association, better known as WWMA. My name is Dr. Taiwan Martin, and I serve in the role of president of WWMA. A brief overview of how we arrived at tonight's conversation. As communities of color continue to experience devastating challenges in the wake of COVID-19, the School of Education and Human Development, Africana Studies, and WWMA felt it was important to create a space and place to host a conversation around the topic of COVID-19 vaccines. And quite honestly, you all, for full transparency, our students wanted us to have this conversation. Therefore, we invited several healthcare professionals to lead us in this conversation. To guide us through this discussion, my esteemed colleague and friend, Dr. Keisha Harrell, clinical professor of kinesiology and sports sciences in the School of Education and Human Development and the executive director of the Office of Academic Enhancement, will moderate this evening's program. Dr. Harrell, please take it away.
Thank you, Dr. Martin. Good evening, everyone. I'm really excited to host and moderate today's panel. We have an exciting panel of experts to have a real talk conversation about the COVID vaccine. Just a little housekeeping before we get started. I will introduce the panel. After I introduce the panel, we will have some specific questions for the panelists, but then we'll open it up for questions and answers. And so when we open it up to question and answers, we really are here for you, and we want to hear from you and get your questions answered. So you'll be able to ask your questions in a question and answer section. And so if you click on the Q&A and type in your question there, your questions will get answered, and we'll try to get to as many as we possibly can. And so in order to do that, to speed that up, I'm going to go ahead and introduce our panel of experts. Our first panelist tonight is Dr. Sanisha Dale. She is an assistant professor in the Department of Psychology in the Health Division, and she's also the Mental Health Disparities Core Director for CHARM at the University of Miami. Our next panelist is Dr. Hansel Tukes. He is an assistant professor at the University of Miami's Health System and the director of the IDEA Exchange. Our next panelist, Dr. Zinzi Bailey. She is a research assistant professor at the University of Miami's Miller School of Medicine and Sylvester Comprehensive Cancer Center. And last but certainly not least, Dr. Prince L., who is a doctor of Oriental Medicine, an acupuncturist, and specializes in holistic and alternative care. Welcome to our panel. Thank you for being here tonight. And so I wanted to start with our first question, and this question can be asked of all the panelists. Can you start by briefly telling us why you are connected to the issue of COVID-19 vaccines and communities of color? So whoever wants to start, take it away.
I'll start. I guess I'll say because COVID-19 is it is us, it's our communities. As a Black woman and a Black woman in academia and a Black woman that's worked in the space of HIV health disparities, it's sad and troubling to see the similar disparities play out in our communities in terms of the disproportionate rates of people who are dying, but also who's able to access the vaccine. It's not getting to us, and we're being impacted.
Hi there. In the same way, I am connected because I study how structural racism impacts our health outcomes and how that results in health inequities. And I do say health inequities on purpose because we have unfair and avoidable differences in health that translate to particular actions that we have taken over time. So our job, essentially in real time, is to identify where we might be making some missteps and course correcting for the sake of equity. So that's what brings me to this.
So I was actually one of the first 9 people in Miami to receive the Pfizer COVID vaccine. And it was such an honor. And that came because I went to Jackson. I knew that there would be differential uptake in the vaccine and differential access to the vaccine. And there's also a lot of misconceptions about the vaccine and about the research and about the pandemic in general. So I've tried to be a leader in public health in Miami and in Florida for my entire career. And I went to Jackson and I said, I want to get vaccinated publicly and I want people to see it, because the number of people who work at Jackson who got the vaccine because they saw me get it warms my heart. The number of my patients who, after talking to me, after I listen to their concerns and I tell them my experience with the vaccine, I only see patients at Jackson. So largely lower socioeconomic status, Black and Brown people. My experience with the vaccine, they trust me. So the same way that the people who work at Jackson trust me, the way that so many people in the community do. So I've definitely wanted to take a leadership role on all of this and lead by example, because this really is our only way out of the pandemic.
I guess it's my turn. I was invited by Dr. Martin to participate in this conversation, mostly from a holistic interest in providing alternative care to conventional systems of medication, especially for the underspoken community of individuals who don't believe in things as synthetic vaccinations, turning to again conventional systems of allopathic and pharmaceutical uh, remedies that ultimately are not specific to individual health, but seem to place more of a social band-aid on the matter, versus also considering that preventing pre-existing medical conditions from worsening is not a conversation that is being spoken about. So I'm very excited to be able to provide that perspective tonight.
Thank you all. My next question is for Dr. Bailey, but please, anyone else who would like to answer, please do so as well. Dr. Bailey, can you please provide us with an overview of public health issues as it relates to communities of color and COVID-19 vaccines?
Well, I mean, there's a multitude of things that I could say. So I'm going to focus in on what we have been experiencing with COVID-19 thus far. I want to kind of rewind to April 2020, when we were starting to get some of the data in, right? Together with some colleagues, we wrote a blog addressing some of this and calling for more data and like more action in terms of racial and ethnic inequities in COVID-19 transmission, so infection. And what we said was, while COVID-19 is largely indiscriminate in its transmission, its propagation within a society steeped in structural racism will undoubtedly lead to disproportionate impacts among marginalized racial and ethnic groups. So for me, COVID-19 has laid bare the structural inequities that create very different conditions for where we live, which apply to a range of different health outcomes and behaviors. So with COVID, we can say, we said a lot in the beginning. You can wash your hands, social distance, all of those things. They're cheap and accessible. Everyone can do it. However, that approach, while it's seemingly cheap and accessible, neglected to consider that prevention is not a one size fits all. It is not, its access is often not equitably or structurally distributed. So in short, there's inequities that have been baked into the system. And those inequities are heightened by when we're rushing, right? The urgent, the segmented, the uncoordinated responses. So when we do that, usually we know who bears the brunt of that, right? People of color are more likely to be in occupations that are essential, who are mandated to work, are more likely to interact with people, the public, yet that risk was not really translated into access to PPE, access to testing, modified test criteria, that sort of thing. We can have questions about vaccination and all of that. There are a number of questions that I have. So, you know, we have done an alternate, we've gone forward with the alternate way of vaccinating in terms of who gets priority. But I do want to, which may have good and bad ways of proceeding. However, I want to call attention for, as an epidemiologist, that when we choose to open to those who are 65 and older, as opposed to you know, non-healthcare essential workers, it is systematically disadvantageous to Black and Brown communities. Because of some of the underlying inequities and medical conditions, chronic conditions that we already know about, that are, you know, put forth in a range of different mechanisms. We know that Black people, for example, are less likely to live to the age of 65. So this focus systematically disadvantages Black communities, right? So put on top of that, wanting to reach those who are 65 and older, who are Black, who are Brown, right? And so just thinking about it, you know, while representing 16% of Florida's population, you know, Black people only represent 8.6% of those who are 65 plus, right? So that is what I'm talking about when I'm talking about structural racism. So we make choices that have implications.
Thank you for that. I feel like that you could continue on for a long time and we could have long conversations about that topic, absolutely. So my next question is for Dr. Tukes, Dr. Dale, and Dr. Bailey. Maybe I'll start with Dr. Tukes. Each of you have been on the media and on campus discussing the reluctance of people in cultural communities to get vaccinated for COVID. Can you share with us the reason for this reluctance?
Absolutely. I'm just so such the awe that I have whenever Dr. Bailey speaks. It's just amazing. I actually interviewed her when she was coming to the university, and just to see her, it's incredible. Absolutely incredible. Sorry. So apart from fangirling, I have to say, so you know, the mistrust of the vaccine is valid. And the first thing that I tell all of my colleagues is we have to listen to the concerns that our patients have. We talk about Tuskegee all of the time and all of the evil that was done with not treating people for syphilis and experimenting on Black people. But the injustice in the healthcare system persists to today. That's why we have differential health outcomes when it comes to COVID. We get COVID at higher rates, just like Dr. Bailey was saying. I mean, you go to the grocery store back in April, every single person working there was Black and they were still there working. We have higher rates of COVID, higher rates of COVID death. And the way to ameliorate some of those health disparities is to increase uptake in the vaccine. So the first thing that I always do is I listen to my patients' concerns, because that's the most important. I answer any questions that they have about the vaccine. You know, many people think that this vaccine was rushed, but if you remember SARS back in the early 2000s, that was when the mRNA technology really came onto the scene. And so we've been working with this technology for 20 years. There was SARS and then there was MERS. So when they got the sequence of the virus, they were able to use the technology that they already had to make a vaccine. They also compressed all of the phases into one. They started producing the vaccine before the vaccine was even approved. That's how we were able to get here so quickly. So after I validate my patients, I let them know, I give them the facts. And as I said, I let them know about my own personal experience. It was so important for me to get the vaccine because I'm a new dad, and I not only want to protect my daughter, but I also want to be here for my daughter's life. And I'm a Black man, I got high blood pressure, you know, I have those things that put me at higher risk. So, you know, it's important for our patients, particularly those of us who serve majority minority patients. I think they need to hear the message from us. And that's why I've been working with Jackson. That's why I filmed the PSA, because it's so important who's delivering the message. That's the way that we we overcome this distrust. And it's just been an honor to partner with Jackson on increasing the uptake in the Black community in Miami.
To add to that a bit, I'd like to reframe it as, are we trustworthy? Like, what have we done to demonstrate to the community, to the Black community, that people ought to trust the medical infrastructures to provide them with something to take care of them? And I think a part of it is historical, like Hansel saying, but there are individuals who may have recently immigrated to the US and they may not know the history of Tuskegee, but their experiences within the context of day to day, what do microaggressions look like? What does mistreatment look like when they show up to get care and they're turned away or no one listens to their real needs, right? Those are the everyday things that are really informing whether or not people view institutions as trustworthy. The other thing about it is that we have to listen to what people are saying. Because what I find is that a lot of people aren't flat out just saying that I'm never ever going to get this vaccine. A lot of it is not yet. And what does not yet imply? Not yet implies that I want more data for myself to understand what are the side effects for these vaccines, how are people reacting to it. And that's a lot of what people are also pulling for. The other thing about it in terms of the not yet is that people do hear of scenarios that have happened across communities of color repeatedly in terms of experiments, why people might say, I don't want to be the first to get this shot, but I do want to collect the data and get the information. The other part of it for me is to understand that throughout this whole pandemic, we have engaged, and when I say we, I think about structurally as a nation, how we have engaged in behaviors that have demonstrated to people at the margins that they are in fact not being listened to. When we think about what has happened and who had access to actually stay home and work remotely, I often told people during the time when everything hit in March and April that I am the only one in my immediate family who had the privilege to actually work remotely, and that everyone else walked out and went to an essential job, right? And the other part of it is too, how are we responding to everything else that's going on, right? The Black community had to witness so many murders and deaths over the summer. Breonna Taylor, George Floyd. How is the nation showing up to take care of Black people in those instances? So if you show me, as a psychologist, we often say when it comes to suicidality or depression or other struggles, we say history is a great teller of what might happen and what you need to be cautious of, right? And so if we're not demonstrating to the community that we care across these issues, across our policies, are they anti-racist or not, right? If we're not demonstrating in other ways that we care, how can you show up to me and say that, here's a vaccine, I really care right now, I just need to get it in your arm. Listen to me as a holistic human being, right? There are many different things that are going on in our community that need to be addressed. And it's the structural issues that got us here that need to be addressed as we are going along with getting the uptake for the vaccine. I myself got, the Moderna vaccine and I got my second shot. And I think the biggest part of it for me has been that I can tell a personal story to family members, to community members. We have a 5-point initiative where we go out to different predominantly Black neighborhoods in Miami, and we're providing HIV testing and COVID testing. And it makes such a difference when someone can say, well, I don't know about this shot, and what am I going to feel? And I was like, man, I got it. And I felt X, Y, and Z. This is what I didn't feel, right? I had one participant who showed up one week at an event on a Saturday. We spoke about it, and they had hesitations because they are, based on their religion, the ingredients in the Pfizer and Moderna was an issue that was raised in their faith as a reason why they should not take that vaccine. And based on our conversation, and one that was really steeped in listening, like, what are your concerns? Who have you gone to in the past when there have been conflicts between your faith and what you may have been kind of entertaining in terms of doing something for your well-being? And a week later, that same individual passes by at another location in the same zip code and was like, I got my vaccine, right? Because they had been qualified, but they were struggling with the questions and really wanted someone to engage with them. So I think it's about acknowledging that there are structural issues, acknowledging that we need to go to people and take the resources to people and prioritize the communities that are the most impacted. That's how we really show that we care. and that we're being compassionate to communities that are being hurt. And also showing up in a fashion where you meet people where they're at. And who are the faces and the people that are showing up to actually engage with communities? We need to think about this in a way that really demonstrates that we care. People are tired of the face value initiatives. People are tired of the matter of fact lip service. Like, people are dying and people want care and need care.
In the interest of time, I'm going to be very brief and echo. We need to listen to people. We can't assume we know what all the concerns are. There are certain things that we do need to be careful about, or perhaps have people talk to their medical providers or their faith leaders about, and be able to negotiate. One thing that I'm going to highlight is that the same underlying conditions or pre-existing conditions, whatever people want to say, that have been emphasized, that are overrepresented in Black communities, those are the same issues that people might have questions about whether they should be getting a vaccine. And people want to talk. They need to ask questions and be able to have real talk about these vaccines.
Thank you. Thank you for that. The next question is for Dr. L. Dr. L, could you please describe a holistic approach to this issue and why some may advocate for people to avoid vaccination?
Yes, absolutely. I think that considerably vaccinations are considered preventative and may reduce or limit exposure. However, these preventatives, they don't consider pre-existing medical conditions. They don't consider bioindividuality. They don't consider the importance and the relevance of a person's faith in their medical choice, as well as any type of medical product or service that's also offered. In consideration to that, I think that at the very least, if certain physicians are advocates for certain pharmaceutical remedies being used, I think that those same physicians should also become advocates of those same remedies being inclusive and in consideration to a person's faith choice. And I think that it's also extremely important to acknowledge that it's also been, and it's also very culturally relevant to this discussion, that certain faith-based practices have historically proven to help certain cultures avoid disease and illness. You know, it's a cultural norm for certain individuals or certain practitioners of certain faiths to maintain a standard of hygiene that, in comparison to, you know, let's just call it what it is, you know, the standard American society and its dietary practices, they're inconsiderate of foreign ideas and concepts towards health. You know, in consideration towards that, I think that that's part of the reasons why many people are again returning to their traditional forms of therapies in efforts to reduce their risk. You know, this in the same way that ultimately physicians in any environment need to say, this is, you know, a layman's intelligence and application or approach towards the situation. And so physicians of all sorts need to consider the intelligence and the access to information that patients have. Now, I think that is also important for me to also say that I am not an individual who is fond of the term people of culture, communities of color. I think that it's somewhat discriminative and prejudice of individuals to ignore a person's cultural relevance and just group them into a Crayola box of stereotypes. All right. And so, given the nature of what a person's culture is, you know, especially considering that it is definitively the arts and other manifestations of human intellectual achievements, you know, regarded collectively, as well as their customs, their arts, their social institutions that create the norms and mores that physicians of all sorts need to consider in their therapeutic forms and approaches. So I think that there's a lot more that I would like to say, but for the sake of time and because I feel that there are a lot more questions that that should be asked and be answered, let's get to it. So I'm going to go back. So.
Thank you for that. So I'm gonna we have a couple more minutes before we turn it over for questions and answers. So I'm gonna turn to Dr. Bailey. Dr. Bailey, you recently wrote an article in the New England Journal of Medicine entitled How Structural Racism Works and the Ways in Which Racist Policies Are the Root Cause of Health Inequalities in the US. Can you describe how this framework applies to the COVID vaccine rollout process?
Absolutely. Thank you for that. So in this article, I will encourage everyone to take a look. Essentially, I'm describing a system of structural racism. So it's a system that is so pervasive that sometimes we don't classify or categorize what is going on. And I would say that, to make it short, that this article emphasizes that racism is not simply the result of private prejudices held by individuals. It is produced and reproduced in laws, policies, practices, sanctioned and even implemented on various levels of government. It's embedded in our economic systems. It's embedded in our institutions, in our norms, right? And probably even embedded in our disciplines. As a lot of us are academics. It's embedded in a lot of what we do. Therefore, our interventions need to recognize that, right? Recognize the degree to which we are going to be addressing some of these issues, which are at the root of the inequities that we're seeing. If I summarize all together, I can say that with this system of structural racism, we must assume that inequities are status quo, right? If we move forward without planning for an equitable, for equitable structures or equitable procedures, those sorts of things, we are defaulting to the status quo, to inequity, right? And that's how we can perpetuate structural racism over time. And oftentimes when thinking about structural racism, they use a quote around those moving walkways in the airport. If you are actively racist, you are like running down that moving walkway. But if you are just standing there, but the moving walkway is moving forward, you can be passively racist in those actions because you'll end up in the same place if you're not taking actions to kind of get away from that place. So I think I urge us to be actively anti-racist, which means running very quickly in the opposite direction. So it takes forethought, it takes planning, it takes humility, and for us to really be thinking about what are the systems already in place that will make this difficult to maintain equity. I'll leave it there.
Thank you. And Dr. Dale, a question for you. Some of the discourse around COVID vaccinations is similar to what initially occurred when AIDS first broke, particularly in communities of color. Can you describe some of the similarities and differences and the lessons learned?
I think at its root, so there's a quote that's coming to mind. I'm sorry, I'm not going to quote the author, but it's stuck in my head a long time ago in public health. And it says, no matter where a disease enters a society, it always proliferates among the most marginalized, right? And I think that is the greatest parallel between HIV and COVID. When we think about who are most being impacted, right? When HIV started to have a dramatic impact, the voices in the community that was seen as being most impacted were white gay men, right? When you look at the statistics today, when you think about HIV, it is predominantly, disproportionately Black men who have sex with men, Black, gay, and bisexual identified men. It is when among women, it is Black women, right? And it is not a matter of, I think one of the parallels with COVID and HIV is that people tend to run to behaviors and say, well, what are the behaviors that these individuals in these communities that are engaging in that put them more at risk, right? Because to pinpoint someone's behavior can almost be easier because then you get to blame them, right, for something they're not doing, versus to question the structure that likely has privileged you and disempowered them, right? And the similar thing happened in HIV that we're seeing in COVID. So within HIV, when people ask that question, and they're often asking around like sexual behavior. So are these individuals engaging in more sexual risk than others? And the data shows us no. If you are to compare Black MSM to white MSM, Black MSM are not engaging in more sexual risk behavior. In fact, some data demonstrate that they are more likely to engage in protective measures. And we're seeing a similar thing play out when we think about even mask wearing in communities, right? There is a center, I think it's in California, who reported some data within the past 2 weeks that indicated that Black individuals are actually more likely to wear masks consistently when compared to white individuals, right? And Black individuals were followed by Latinx and then other people of color, and white individuals were the last. So again, the idea of behavior. I think the other thing that's similar and parallel is when we think about stigma, right? And how people are scared of something and then what they do in the context of being scared and othering people. So we saw stigma is still at play when we think about HIV. We see that still in the context of COVID now. You know, I've had individuals, I remember an individual said to me, but you know me, Dr. Dale, you know, I'm good. You know, why are you wearing your mask? Are you scared of me? And I had to, you know, kind of break it down and say that I'm wearing my mask to protect you and to protect me. And I know that you want to somehow indicate that we are close and we're kins, and therefore, you know, this is not something that we have to deal with, but we're close and we're kins and we have to wear the mask to protect each other. So I think similarly, there's a lot of fear. There's also misinformation. You know, earlier on, science struggled to discover how HIV was being transmitted. What are the kind of the active medications that are going to help to make it into the chronic condition that it is today? I think similarly, there may have been moments where people were fed a lot of misinformation. You had AIDS denialists who literally went on campaigns and took that campaign to South Africa to deny the existence of HIV and AIDS. And so I think that we're also seeing parallels in misinformation when it comes to COVID. And we've seen it at the national level where individuals who are given power were actually misusing that power and selling misinformation to communities. Right. And so I think there are a lot of parallels that can be drawn. But the one I would say that we really need to pay attention to is step away from just trying to pinpoint behaviors and focus on the structures that got us here and the structures that need to be addressed to get us out of this.
Can I add to that? Yeah.
Yes.
So Dr. Dale, you know, on the topic of HIV, so I may seem tired tonight. I just came off of 14 days straight on the HIV service at Jackson. And I have to tell you that there were 14 Black people on my team that were all dying of AIDS in the year 2021. And people forget that. I really don't want us to be in the year 2041 and there's a team just like the one I just signed out that's all dying of COVID. Black people have been completely left behind in all of the progress that's been made in ending the HIV epidemic. That's very, very evident because Black people die of AIDS every single day in the state of Florida. And COVID just made things worse. There was differential access to telehealth, the digital divide. My patients were not able to keep in contact with me because they didn't have access to smartphones. Speaking of structural racism, there's not even broadband wire laid in Liberty City. That you know, that I didn't know that before. All of these things have just made outcomes worse, which is why I just took care of a team of people who were suffering the consequences of the pandemic on top of the HIV epidemic. So I really do feel that the way for us not to be left behind in terms of the COVID epidemic is for us to get vaccinated, because otherwise it's going to be the same thing. You know, COVID will will not be a major issue in some communities, but we'll be here 20 years from now and there'll still be Black people dying every day of COVID. And we cannot allow that to happen, and we won't.
Thank you. This has been fantastic. I want to take time to give our audience opportunity to ask questions. So
But
now is
before
the
you
time
do,
to,
I'd
to
also like
definitely.
to interject on
Oh,
that same conversation of behavior. Like, you guys just like kind of touched on a subject that I feel like definitely needs to be spoken about from a clinical perspective, as well as a holistic clinician's perspective. And that, there are a couple of things that I feel may not necessarily be historically addressed properly. And one of them being that historically, prior to certain systems being desegregated, right, there were systems of healthcare that already existed where the, communities of color, as is being identified within this discussion, were far less at risk of many of the societal diseases that are now prevalent and essentially are pre-existing medical conditions that many people are also identifying the communities of color as being high risk. I think there also needs to be a recognition of the enabling healthcare provider that does not also establish and assess certain destructive lifestyle choices that also are conducive to the deterioration and degeneration of an individual's health. These things are not spoken about on a regular basis. They are also promoted highly within the entertainment complex, And so, like, if we're really going to be addressing like healthcare from a holistic perspective, like all of these things need to, like, as far as behavior, really needs to be reassessed from not only a historical perspective, but also an entertainment perspective. Because again, like what is not being discussed, even like with this within the much of the conversation so far, I really have to say that I'm rather disappointed that that there's not a discussion that's also just encouraging the reduction of high blood pressure, the management of diabetes, of obesity, of hypertension, of autoimmune disorders, of like access to healthy food sources, as well as education. If there's anything that is relevant regarding color, more specifically culture, it is the access and the likelihood of individuals as well as that become patients or may become patients to also be influenced by, and without that also being included into this conversation, like I think that like we're doing any guest or any viewer a huge disservice by not speaking on that. I think that natural alternatives are also not being discussed in comparison to the importance or the use of mass vaccinations. Again, it's a mass band-aid. It's not specific to individuals, and therefore it's just completely ignoring whether we're going to assess communities that are affected by this the most. Like, it's not including the communities that would culturally turn to holistic healthcare as a form of self triage systems of healthcare management. We're ignoring the intellect of many of our patients, especially when we regard them as colors and not respective to their cultural norms and their traditional practices. And if we could include that into the system, I think we would see a much bigger difference in a reduction in the presence of COVID-19 as well as HIV virus, and the further degeneration of that virus into AIDS. Because if there's still a population of people that are still increasing in number that are developing acquired immune deficiency syndrome, it's because the practitioners are not making adjustments in their patients' lifestyles, and therefore they themselves are enabling patients to continue to be patients and not to recover. And thank you for that.
Thank you. I think you
Real
raised
quick.
some really good points. We have some questions from the audience. So yes, if you can make it brief, absolutely.
I'll make it really brief. Dr. L, I don't actually think that it's necessarily a differential opinion or sides of any sort that we're speaking of. I think one thing you're bringing up is the need for humility and cultural humility and understanding people's background and beliefs and what their individual questions, concerns, and ways of approaching medicine and care is going to be, right? And I think it is something that is actually not incongruent with a conversation around vaccine, right? I'll insert something real quick. So I come from a Jamaican family. So growing up as a kid, ginger, right? Get your lemongrass. I used to be sent to pick all these bushes, right, to drink. And so I have an appreciation for holistic medicine, and so do the vast majority of people from my background. But it doesn't prevent conversations around the fact that ever since I was a child, I've been vaccinated with polio. I've been vaccinated MMR. Like there's so many vaccines that have allowed me to live right past dengue fever and other things during childhood that it's still something that has helped us to be
And I
here
don't,
and to
I
thrive.
don't, and I apologize not to interject or to interrupt your point. However, those same vaccinations have also scientifically and historically been proven to not necessarily be as effective in a society that has essentially improved its hygienic practices. The diseases, polio, MMR, are all diseases that are related to poor living conditions. When those conditions are improved, even dengue fever, when those conditions are improved, the environmentally, the people who surround or inhabit those environments also improve. It's a matter of improving lifestyle or improving living conditions. And so again, one of the things that needs to be included in this is extremely important is environmental concern, regarding people's health. And because
Yeah.
polio
I hate to interrupt. I'm sorry,
yeah,
I hate to interrupt, but I want to make sure. I think it's really safe to say that we need to have more of these conversations, and I'm looking forward to more of them because. Dr. L, one of the reasons I apologize for interrupting, but we have a question for you coming up as well. So I want to make sure we get to that because it's specifically for you. The first question, however, though, is a biggie, is a big one. So it looks like it has Dr. Tukes written all over it. But I'll read this one. There are different vaccines for COVID: mRNA, Moderna and Pfizer, dead virus, Sinovac, genetically modified virus, AstraZeneca, cold virus to deliver generic material from coronavirus, Johnson and Johnson. Why? Why so many? Are these different methods equivalent? Are there genetic considerations with regard to treatment?
Well,
Anyone want to take
I
that?
have to say the person who wrote that question knows way more about vaccines than they're admitting, based on the fact that they could say the mechanisms of all the different vaccines. So they are all different. Right now, we only have two vaccines that have emergency use authorization, and they're both mRNA vaccines. The next vaccine that will get authorization is the Johnson and Johnson, and that is an adenovirus vaccine. And so, it's they're all different because we had to make vaccines for using the technologies that had delivered vaccines in the past, like MMR and tetanus and all of those. But then we also had to try different technologies because this was a worldwide event that was happening. So the vaccines have different effectiveness, but the thing that's most important that you have to look at from all the vaccines and all their different mechanisms, like if we just step back and look at the larger picture, even though Pfizer and Moderna have 95% effectiveness against moderate disease, these other vaccines, all of the vaccines are 100% effective against death. And that's the most important, right? That's the most important outcome, the ultimate outcome. So even though they utilize all sorts of different technologies, they all ultimately will help prevent mortality, and that's what's most important. So what I would like to say to that question is when the vaccine becomes available to you, whatever vaccine it is, please take it. We have to prevent this virus from being able to hop from person to person. and 66% effectiveness, which is the Johnson & Johnson vaccine. That is an incredible effectiveness. The 95% that we have with the mRNA vaccines is absolutely unprecedented. There's nothing that's that effective other than like the measles vaccine. So we have all of these different technologies. What I can say is that none of them are live coronavirus. What they do is they give your body a recipe to make a portion of the virus so that your immune system can form a response. And after receiving the second vaccine, I can tell you that you can feel your immune system form the response. But with that comes the comfort that you are now immune to the coronavirus. So whenever the vaccine becomes available to you, I would take whatever vaccine is coming your way, because we have to prevent transmission. So we have the people who have been naturally, have immunity because they were infected with coronavirus. And as we increase the number of people who are immune by the number of people who become vaccinated, eventually the virus will have nowhere to go, and this will all end.
Something else that's not
Thank
being
you.
discussed is just how, a virus also, progresses in its development, and how it's also transmitted, and certain environmental factors that reduce the likelihood of transmission, as well as both internally and externally. Again, more information that is not being promoted to the potential recipients, as of the vaccine, as well as individuals who may not necessarily be interested in taking the vaccine. I think that it's very interesting that, certain communities are right now more interested in being included in a system of healthcare that historically has proven to not be able to address its medical concerns. And again, while there is a medical system that is in place to to tackle the life-threatening sides of the illness, we're still completely ignoring the fact that a virus makes a person's immune system weak to the point where an opportunistic infection is now the contributor and main concern, right? The high blood pressure, the respiratory disorders, the renal disorders. These things, again, while vaccinations may address the virus concern, the pre-existing medical condition is not being addressed. And so again, a system of healthcare that is ultimately still enabling patients and not addressing the root of why the virus is so dangerous, because the opportunistic infection.
That's
All right, I
actually
think we
not
have-
how the coronavirus kills people. The coronavirus kills people from an overwhelming immune inflammation response that causes multi-organ dysfunction. It's not opportunistic. That's the way the HIV virus works.
Arguing semantics. We're arguing semantics in that context. That's not.
No.
Yes, it is.
And it's a completely different mechanism of mortality.
Overwhelming the immune system.
Okay.
It's an autoimmune disorder, right? Which
And
again
so-
makes it to where an opportunistic infection is the primary concern of a person's death. Mortality, it has not been shown that that deaths related to COVID are specifically just COVID solely influenced deaths. There are also morbidities that are influential factors to be taken into consideration, and again are not being discussed.
I think
And
if I
I'm
was
gonna
to interject,
Okay. So
sorry,
I'm going
if I
to
was to,
interject as the
go ahead.
because we have 5 more minutes, and I want to give everyone an opportunity to get their last point in. And so I'll ask the last question, and everyone can answer it as our final question. And I think it's really safe to say that we're going to have another one of these if there's interest. And I think because we have so many areas and so many questions that we didn't get to. So the final question: what is the most important thing you think that you feel our community needs to know about COVID, the COVID vaccination, or virus pandemics in general, now or in the future? What do you think is the most important thing you feel our community needs to know?
I guess I'll start. We need to live. We need to be here. As a community, when I think about Black people, I think about our unwavering resilience through everything that we've been through, generations after generations. And we did not create the structural inequities that we have been dealt. Racism and everything that has happened over the past 400 years is something that we are facing the consequences of. It has created a situation in the context that has allowed COVID to impact our community so adversely. And this vaccine, access to testing, access to the vaccine, is an opportunity for us to be here for ourselves, for our children, and for the generations to come. We have told our stories repeatedly, and I want us to be here. And I want us to take advantage of what there is in order to be here. If you do not understand the differences between the vaccine, seek out someone who does. If there are questions that you have, find someone who could answer them. But please, we need to be here to keep this train moving.
I think I started by saying that when the vaccine becomes available to you, please get it so that we can halt the chain of transmission. But I will say, until that time, continue, well, even after you get the vaccine, continue to wear your mask because that has been shown to be effective in preventing transmission. And, you know, if we all just wear the masks and if we all get the vaccine when it becomes available to us, we will get through this on the other side. And all of this work that we're doing, I just have to share, you know, with my colleagues, you know, the elders are looking at us. I received a call from the legendary Miss Thelma Gibson this weekend, who is a pioneer Black nurse in our community. And she's just so proud of all of the efforts that we're doing to make sure that the Black community is educated about the vaccine, has their questions answered, and then has access to the vaccine. So when you can get the shot, get the shot. I'm Mrs. Thelma Gibson is speaking through me. Get the shot, but continue to wear the mask so that we can all get through this terrible time.
I will say that, like Dr. Dale said, we need to be here, right? We have the resilience as a community. There are going to be some of us where we can get the vaccine and we have access to the vaccine. Get the vaccine if you can, right? If you can't get the vaccine, if you have a medical condition where you cannot get that vaccine or you have to navigate other elements, make sure that you are, you know, practicing all the preventive behaviors that you can, that you might have control over. Make sure that you potentially have been able to organize to get the appropriate protections at your workplace, in your home, be able to figure out some of the elements around you. And I would say that holistically on a community level, we have to be thinking of every step along the way. We're not going to be all in the same place at the same time. So we need to be thinking about vaccines and access, distribution, and inequity. We need to be thinking about care, the inequities, equity, right? We need to be thinking about prevention, right? The equity concerns around that. And we need to be thinking about how do we live our best lives, because this is not the only pandemic that we're probably going to face as a people, right? So what are the things that can bring us into the next generation?
As a concern of importance is on the prevention of transmission and the, my emphasis remains on the prevention from a holistic management of diseases, essentially the result of lifestyle-based adjustments, with an increase to access to information, which must be promoted more within communities of culture that are specific to the biology of the individuals and the individuals that must be informed or educated in the prevention or management. Patients must be made responsible ultimately in a way that they understand, increase education, and make it inclusive to concepts of culture within medicine that are not ultimately band-aids. Many of us who come from communities of culture, who have, through chance or through sheer persistence of will, have reached a level of education which ultimately places us in positions of responsibility to those who are depending on us for information from those same places that we come from. And for those individuals that come from the communities that I come from, it's important that those individuals recognize that they must do everything holistically within their capability to prevent themselves from acquiring the disease, the virus, and the likelihood of its transmission. All right. Whether we believe in a vaccine or not, if it's a life-threatening scenario, if it's going to do the job, I'm in full support of a vaccination. However, in preventing an individual from reaching the place of where they need such emergency care, which has again been disparingly, disproportionately unfair to those individuals. Again, those individuals in those communities, take care of your cholesterol, take care of your diabetes, take care of your blood pressure, take care and support your immune system by consuming foods, herbs that can essentially have the same therapeutic effect as its conventional allopathic, pharmaceutically based, financed choice and selection. All right. We need to not even forget about the fact that there's economics that are also influencing the promotion of those vaccinations, which again are harmful to many people. They will have many more side effects that will come from the use of those vaccinations. And I get it. For physicians that are willing to deal with the side effects and the symptoms, I give you the credit that you need and that you deserve for being able to deal with the problem that you ultimately are creating by enabling patients to continue destructive lifestyles.
I'm sorry, can I interject here? Because I do think that there's information and there's information. And I think we have to be careful. One, I will say this, there's one thing we agree on, that there's structural inequities. And if we think structure, we're going back to the fact that it doesn't just come down to your individual behavior. There are issues that are impacting people's health. Is there enough trees around where the air that you're actually breathing is as healthy as someone else that is 10 zip codes over, right? Are you able to live in a single family unit so that in the context of COVID, you can actually social distance, right? Or do you have multiple families living in the same unit that's gonna therefore impact each other, especially if a portion of those are actually essential workers? The other thing here we have to be really careful of is this. The side effects around the vaccine, and I could speak for myself, right? The side effects I got from Moderna, even my second shot, was mimicking my response to the flu vaccine. I've been getting the flu vaccine for over a decade, right? And my Moderna second shot did not give me adverse side effects. Some people I know who've also gotten the Moderna, some of them have had some fevers, some fatigue, some muscle ache. But the fact of the matter is that's the vaccine doing its job, right? That is your immune system waking up and saying, hey, if vaccine come at me, I'm going to be ready to fight. And we have to be careful that we're not feeding misinformation that has already been dealt to our community that is persistently being impacted in the context of talking about COVID. Like, we need to be here, and we have to be very clear about the facts and what is actually going to help us. I love me some ginger. I love holistic medicine, but there is a pandemic that is killing our community, and we have to be able to talk about this.
Coming out. People who rely
right. Well, I would like to say thank you.
Medicine that recovered without the use of vaccinations, that there was over a 60% recovery in individuals who did not have pre-existing medical conditions. Those statistics need to be spoken about. The fact that management of pre-existing medical
I'm sorry, I have to interrupt. Out of respect for our panelists and for our audience, we're well over our time, but I definitely want to ensure you that for all the questions that are in the question and answers, I will save them. We will find a way to get those answered. Hopefully, we could convince the School of Education, Africana Studies, and WWMA to have another session. And I hope the panelists will come back and join us. I just want to take this time to say thank you to our panelists. I think the information you provided was very important. For participants in the audience, thank you for attending, and look out for our next COVID Real Talk. Thank you for joining us tonight.
Thank you, everyone.
Thank you.
Thank you.
Stay safe.
Thank you.
Thanks.
Hey.
Peace and
Thank you
blessings,
all.
all. Thank you, thank you, thank you.